there have been, I think, a couple of misnomers out there or information that's not exactly accurate. So let's try to get that solved why we have experts here. There's been some reference lately to the CDC mask study. The study wasn't actually on masks, obviously, but it was referenced by several people online and then referenced by the President of the United States during his town hall last week, saying that 85% of the people that wear masks get I think he said caught COVID, but is there any reason scientifically or common sense wise to believe that someone who wears masks is more likely to get COVID?
So thank you, Senator, for highlighting that. That does not sound scientifically correct to me. Again, masks are a known thing. Masks didn't just come into play in 2020. We've been wearing masks in healthcare for some time. We know that masks prevent spread of droplets. And that's why, again, we wear them in healthcare, and that's why we're wearing them now to prevent the spread of COVID-19 in the community. So masks work. They do not increase the spread of the disease. They decrease the spread of COVID-19.
Thank you. Another thing we've heard a lot about recently is the term herd immunity. Now, the second word in that phrase sounds pretty good. I mean, immunity, obviously everyone would think that would be a positive thing. It's the first word in that phrase that I think we need to understand, because the word herd means people. And so let's talk about herd immunity for a second. Do we have any idea at this point, best scientific guess, of what percentage of people have been exposed to COVID in Michigan?
Yeah, that's a great question. So there was a recent study that showed that about 9% of, again, that was an estimate, but about 9% of people in Michigan had antibodies to the disease. And then that was based on a study out of Henry Ford, I believe. But again, to your point about herd immunity, usually when we talk about herd immunity, you're talking about herd immunity because of a vaccine. And that is because you need to have a very large segment of the population who is immune to a disease before you start seeing a decrease in the spread. And scientific, experts across the country say that's up to 80%. So 80% of Michiganders would have to be immune to the disease before we have herd immunity. And again, as I said in my opening remarks, that's just not something that is, that's inhumane. We cannot have 6 million additional Michiganders infected by the disease. We can't have 30,000 more Michiganders die as a strategy for herd immunity. Again, national experts have said this. There's just no question herd immunity by natural means is just not a good strategy.
Some people, thank you. Some people have pointed to Sweden as an example of some place that is trying to use the herd immunity strategy. And what was that? And if you look at their surrounding states, their surrounding countries in Sweden, would it surprise you to know that they have 5 times the death of Denmark and 11 times the death of Norway trying to use this strategy?
No, that would not surprise me at all. Again, any strategy that says natural herd immunity is the way to go, you will see a disaster with infections and deaths. So that is not a surprise at all.
I know you're not an expert in economics, but if you looked at those 3 countries, would it surprise you to know that the GDP of Sweden actually fell further than both Denmark and Norway from using this strategy? So one group used social distancing, mask mandates, all kinds of other mitigation techniques. One state one country used the herd immunity strategy, and the economics of Sweden actually fell further than those that were actually had shutdowns and other things. Would that surprise you?
Not at all. And you bring up an important point, which is that public health and the economy are intertwined. They're not oppositional. Even if you look at the Spanish flu, the pandemic of 1918, those states that were more aggressive and successful in actually controlling the spread of the disease had an earlier and more robust re-engagement of their economy. In fact, again, I'm not an economist, as you said, but the last data that I had presented to me showed that Michigan was actually doing much better than a lot of other states when it comes to re-engaging the economy. So again, the virus is the enemy. The more we can get ahead of and control the spread of the virus, the better we'll be from a health standpoint, and the data shows across the globe from an economic standpoint.
Anyone who's pushing the herd immunity as a strategy here should look with our partners in science that would show that that as a strategy would leave somewhere between 5 and 11 times more deaths, a decrease in the economic well-being of our state would not even work because we don't even know the long-term immunity and could have terrible, terrible consequences for our citizens moving forward. So I agree that we should treat the public like partners, but that also means that we level with them and we give them actual real information, and we don't push strategies that could lead to long-term harm. And so I appreciate you giving that information to the committee. Thank you.
Senator